Hello and welcome to another episode on dental malpractice. Today we're going to be talking specifically about dental implant malpractice. Dental implant malpractice is a fast-growing area of dental malpractice. Millions of dental implants are placed every year, and that number is steadily going up. When an implant procedure is done properly, the patient has a great solution for a missing tooth. However, when a dental implant procedure goes wrong, it can be a mess. Placing a dental implant involves drilling into the patient's bone, and bone takes a long time to heal and regenerate. Thus, a botched dental implant procedure can cost thousands of dollars and months or even years to repair. In the worst cases, the damage is permanent.
So what is a dental implant? If you Google dental implant and check out the images, you'll see something that looks a lot like a screw. The most commonly used type of dental implant is what's called a root form implant, which is basically just a titanium screw that goes into a patient's jaw. Once placed into the bone, that titanium screw integrates into the bone and provides an anchor for a crown or a denture. Although there are other types of implants, this implant is by far the most common, and it's usually what people are talking about when they talk about dental implants.
Now, let's talk about the process of placing a dental implant. A typical dental implant surgery involves drilling a hole into the jawbone and then screwing an implant into the bone. Of course, if there's a tooth there, you have to remove that first. Once the implant is placed, it typically needs to integrate into the bone before it can handle the full pressure of a bite. Otherwise, the pressure of the bite could make the implant wobble and fail. So, to avoid putting too much pressure on a newly placed implant, the dentist may cement the temporary to adjacent teeth. That way, the pressure of the bite goes into the adjacent teeth instead of the freshly placed implant. Also, the temporary is nice because then the patient has a structure that looks like a tooth instead of a gap. Finally, once the implant integrates into the bone, the dentist will place the crown on the implant, and if everything goes well, the patient has a beautiful tooth with a sturdy foundation.
The reason for dental implant malpractice lawsuits is error, which we lawyers call a breach of the standard of care. The standard of care may be defined as what a prudent doctor would do under the same or similar circumstances. You can think of it as the acceptable level of conduct for a dentist. There may be one or several errors at issue in any given dental implant malpractice lawsuit. These breaches of the standard of care form the basis of the injured patient's claim for damages. The most common errors are a result of insufficient training, insufficient preoperative planning, improper imaging, and insufficient review of a patient's medical history. Let's touch upon each of these issues in detail.
Insufficient dental implant training and credentialing is a big reason for dental implant malpractice lawsuits. Oftentimes, a dentist with little experience placing implants and none of the proper credentials or training will attempt to place implants when the dentist really should have referred the procedure to a more qualified implantologist. At the very least, while obtaining the patient's informed consent, the dentist should have told the patient that there are much more qualified implantologists who could get the patient a better result for the same money. Ultimately, when one of these unqualified dentists tries to place an implant, bad things can happen, including infection, implant failure, permanent nerve damage, and other terrible things. Also, the implant may integrate into the bone, but at an improper angle, which could ultimately cause the patient more trouble than if the implant had simply failed, because then some other dentist is going to have to go in and remove the implants, build back the bone, and start all over. And this process can take months or even years, and it can cost tens of thousands of dollars.
Now, we talked about insufficient dental implant training. So let's talk about insufficient preoperative planning. During the planning phase and before attempting a dental implant procedure, the clinician must conduct a pre-surgical diagnosis of the patient to determine the overall complexity of the case, as well as the proper course of action. This is arguably the most important phase of the dental implant procedure, and sadly, it's often overlooked. When a dentist fails to properly plan for a dental implant procedure, the dentist puts the patient at risk of serious and permanent injury.
Now, let's talk about the next big issue in dental implant malpractice: failure to take proper images. Studying images is a part of the preoperative planning phase, but it's so critical that it deserves special attention in this video. One of the most common reasons a dentist will injure a patient during a dental implant procedure is because the dentist failed to take proper images in the preoperative planning phase. For example, dentists who take only two-dimensional images in the planning phase greatly increase the risk of damaging the patient. It's nearly impossible to properly assess all the vital structures surrounding the dental implant site without a high-quality three-dimensional image. As of 2010, the use of a CT scan was considered mainstream for implantologists. In more recent years, cone beams, or CBCT scans, have become even more popular because they expose the patient to less radiation than a CT scan. Also, cone beams provide a high-quality three-dimensional image that is excellent for preoperative planning. For this reason, cone beams are quickly becoming the standard of care in implant dentistry.
The final dental implant malpractice issue we'll talk about today is the failure to study the patient's medical history. Some of the most horrific injuries occur for this reason. For example, patients with compromised immune systems, like people with diabetes, can develop horrific and life-threatening infections after a dental implant procedure. Similarly, patients who have been administered bisphosphonate drugs may experience increased incidence of dental implant failure, as well as more serious and debilitating conditions like osteonecrosis of the jaw. Thus, when a dentist overlooks a patient's medical history, the patient is at a much higher risk of complications or even death as a result of the dentist's negligence. For that reason, this is a common issue in dental implant malpractice cases.
Now, we've talked about a lot of gruesome and scary stuff today. However, there's hope because things are changing in the dental implant world, and dental implant malpractice will hopefully become much less common over the coming years. At the present time, dentists are not required to have specialized training or credentialing to place a dental implant. In other words, anyone with a degree in dental medicine and a license to practice dentistry can screw a piece of titanium into a patient's head. This is a lot like the days when any doctor could perform brain surgery without specialized training. Thus, we're in a unique Wild West phase of implant dentistry, and history shows us that this will not last forever. For example, dental schools are currently developing residency programs that train dentists to become specialized in dental implantology. Additionally, organizations like the American Board of Oral Implantology have programs to credential the best of the best in dental implantology. Therefore, it's likely that in time, only truly qualified professionals will be placing dental implants. For that reason, dental implant malpractice should become less and less common, and less people will suffer injuries and complications as a result of dental implant procedures.
Thank you so much for joining us today for another episode on dental malpractice. If you like our content, please smash like and subscribe to our channel, and we'll see you at the next episode.